Hi, I'm Pratik, and in this video we're going to be looking at consent in dentistry. This is such an important topic, so please make sure to watch all of this video. The content of this video, along with the revision note on ExamineDental, has been created in conjunction with the MDDUS. If you are concerned about gaining valid consent from a patient, then you can seek advice from the MDDUS, a mutual defence organisation who will be by your side to provide support and protection. Their in-house team of dental and legal experts can help you manage risk, handle complaints, and help build long-lasting trust. Membership is free for students and it's only £10 for dentists in training. You can become a member by visiting MDDUS.com, and this will allow you to receive support that is actually useful, actually human, and provided by dentists who have been where you are. As dentists, we have a legal duty to gain valid consent from patients, and this is reinforced by GDC Standard 3. We must gain consent from patients, especially for investigations and any treatment that we plan on carrying out. There are three basic principles of gaining valid consent. The first is that consent must be voluntary, i.e. the patient should be giving consent themselves and not through any pressure. Next, the consent must be informed, so the patient must be given all the relevant information as required. And finally, the patient must have capacity, i.e. they must have the ability to actually make a decision. Consent may be implied, such as a patient sitting in a dental chair and opening their mouth before you ask them to, in order to have a dental examination carried out. Or it could be expressed, where you have to gain valid oral or written consent. As part of assessing a patient's capacity, it must be time and decision specific. For example, if a patient temporarily lacks capacity, then we should ideally delay the decision making if possible, such as a patient who is intoxicated. As part of assessing an individual's capacity, there are 4 steps. The first is that the patient must understand the information provided to them. This may include giving the information in a variety of formats, such as in a written form or using an interpreter. The patient must then be able to retain the information that was provided to them. They then need to weigh up the information, and finally, they must be able to communicate a decision back to you. This doesn't necessarily have to be a verbal communication. If we find that a patient is lacking capacity permanently, then we have to use the principles of the Mental Capacity Act of 2005. There's more information about this over on the ExamineDental website. It's these types of situations where you may want to reach out to your indemnity organisations because the rules and regulations vary slightly across the United Kingdom. Another key aspect of consent in the UK is the Montgomery Ruling. In 2015, the Supreme Court ruled in the Montgomery versus Lanarkshire Health Board case, and this essentially changed the way we gain consent from patients. Prior to this point, we used to use the Bolam test when determining how to gain consent and the information that we needed to provide to a patient. As part of the Bolam test, essentially, a dentist would have to provide a patient with the risks and the information related to an investigation or a treatment that a reasonable body of professional opinion would do in the same situation. However, with the Montgomery ruling, the requirements have changed slightly. The Montgomery ruling essentially means that as healthcare professionals, we have to provide patients with all the material risks of an investigation or a treatment. Along with this, we need to ensure that we disclose any risks that a reasonable person in the patient's position would attach significance to. And this is where it becomes slightly complicated because a material risk will be patient-specific, and therefore as healthcare professionals it's our job to determine what may be of material risk to the patient in front of us. Taking all of this information into account, we can create a basic framework for gaining consent in dentistry. First off, we want to actually provide the patient with the information. So we need to ensure we give the patient all their treatment options, including the option of not doing anything, the repercussions of these options, including the pros and cons of each of them, the costs if necessary, and the prognosis involved with each of these options. Along with giving the information, we need to ensure we use those basic values of consent, of ensuring that the consent is voluntary, it is informed, and we've assessed the patient's capacity. Once we've given the patient information, we should ideally be giving them sufficient time to actually make an informed decision about any investigation or treatment. So for example, if a patient is going to have a general anaesthetic, ideally we should be giving them all the information regarding their consent, carrying out the written consent at their consultation appointment. This is probably then reiterated on the day of treatment, but by having the time between the consultation and the treatment, it gives the patient a cooling off period and sufficient time to actually consider the consent process and consider the decision that they've made. We also then need to ensure that we document everything. Whether this is simply a verbal conversation we've had with the patient and we want to keep a record of this, or a written consent form that we've got the patient to sign. We know that a written consent isn't proof that a patient has given consent. However, it's useful to still have this level of documentation. If we now consider age-related consent in dentistry, any adult, i.e. anyone of the age of 18 or above, is presumed to have capacity in the first instance and therefore be able to consent for themselves. If they have capacity and they make an irrational decision or they refuse some treatment that you would recommend, We need to respect this decision as the patient has capacity. It is different if the patient is lacking capacity, in which case we'd have to follow the Mental Capacity Act as mentioned. If a patient is 16 or 17, then they can actually consent for treatment in the same way as an adult. However, if they refuse treatment that would actually be in their best interests, then they can be overruled by someone who has got parental responsibility. And finally, if we consider children under the age of 16, then their ability of giving consent actually depends upon their level of maturity and their ability to actually understand the investigation or treatment that we're embarking upon. This is often referred to as Gillick competence. As part of assessing a child's Gillick competence, we use the same types of tests that we use to assess an individual's capacity. So we want to see whether the child understands the information, retains the information, can weigh the information up, and can communicate a decision back to us. Therefore, it is possible that a child is able to consent for a simple intervention, such as applying fluoride varnish to their teeth. However, they may not have the Gillick competence to actually consent for a more significant treatment, for example, having a tooth extracted. If a child is not Gillick competent, then an individual with parental responsibility would be responsible for actually making a decision on the child's behalf. In England and Wales, a child's biological parents both have parental responsibility provided they were married at the time of the child's birth or marry later on. A father named on the child's birth certificate also has parental responsibility if the child was born on or after the 1st of December 2003. A biological mother automatically has parental responsibility unless this is taken away from them. There are also certain special considerations with regards to consent in dentistry, such as if a patient is having emergency treatment or they're having treatment under sedation or a general anaesthetic. You can read a little bit more detail about this over on the ExamineDental website. So in this video, we've looked at consent in dentistry. We've looked at the basic principles of consent as well as how to assess a patient's capacity. We've looked at age-related consent as well as a basic framework for consenting in dentistry. This is an incredibly important topic, as I've mentioned, and we go into a lot more detail in our revision note over on the ExamineDental website. There is a cheat sheet attached with this, and this content has been created in conjunction with MDDUS. Therefore, it's extremely valuable as part of your career. All the links to the content mentioned in this video are in the description below. I hope you find this video useful. And if you did, please make sure to like, comment and subscribe. Until the next video, take care.